Alrighty, hello everyone. This is my case study video. Um, I decided to do my case study video on a 90-year-old male patient of mine that um, I saw at my current internship. Um, he was a super cute guy. He was really nice and he came with his wife. And this isn't a picture of him, so no HIPAA issues there. But this is a picture I got off of Google. So I just thought it was a cute, happy little picture. So I thought I'd include it in here. So we're just going to hop right in. Okay. So this is the history part. I'll just read it out now. So this patient, and this is written from like the perspective that it just happened today. So, okay. So the patient came in the clinic today for an updated hearing evaluation. He was accompanied to today's appointment by his wife, and he and his wife were so cute. They were very nice. Yes. So his last hearing test was on September 17th, 2019, and that test revealed a bilateral, moderately severe, sloping to profound sensorineural hearing loss. This patient was fit with Phonak ITC devices after that appointment, before I got there, and that was for both ears. And at his most recent appointment, he reported overall satisfaction with his devices in general, but there were certain situations that he wanted to have a little more help. He has been listening to the TV too loudly, according to his wife, so there were issues there with the volume of the television, which you hear about all the time. So that was something that they brought up, they wanted to talk about. He also brought up that he has issues understanding speech with the presence of background noise. And he reported that he experiences ringing tinnitus in both ears, and he said that his perception of the ringing has decreased or subsided since he was fit with his hearing aids. He attributes this ringing to his service in the military, where he was exposed to noise and did not wear hearing protection all of the time. He denied experiencing any ear pain or pressure, dizziness or vertigo, new exposure to noise since his last hearing test, or significant history of ear infections or ear surgery. Okay, so, okay, whatever. So, these were the results of his testing that we did on May 10th, 2021. He decided that he needed to come back in because he thought he had been noticing some changes. And so these were the results of the testing that we did on that day. Otoscopy revealed clear canals with healthy appearing tympanic membranes bilaterally. We decided to not test tympanometry today. That was my preceptor's decision. Yes. SRT, he came in at 70 dBHL in both ears. And then audiometry, this is the audiogram here. We can see that there is a moderate sloping to profound likely sensorineural hearing loss. So we included likely because it's sensorineural, but at that 4,000 frequency, we could not mask the bone conduction due to the severity of the air conduction thresholds, which I made that little note there with the star. But I think it's safe to assume that it is sensorineural. His word discrimination scores, speech discrimination, the patient scored poorly at 36% when recorded. NU6 word lists were presented at a louder than normal conversation level at 90 dBHL, and that was for both ears. Okay, so I got cut off there, but we're going to keep going. So the interpretation of the results of today's testing are as follows. I'll just read these out. All results are in agreement with each other, and reliability is believed to be excellent. He was a very good responder who's very, I feel very confident in his responses and in the results that we saw today. Today's testing revealed a bilateral, moderate to profound sensorineural hearing loss. A slight decrease was seen in overall hearing sensitivity since his last, and word discrimination scores since his last hearing evaluation on September 17th, 2019. And this line here is from the report and like the reporting style that they are doing at my current internship. So results were discussed with patient and his wife. And so we were able to look at the audio all together and explain what we're looking at. And, he showed understanding. So everything was good with that. So that's that line of results were discussed with patient and his wife. Okay, so diagnosis. A variety of factors are at play that could be the cause of his hearing loss. But like I said before, it was that moderate to profound sensorineural hearing loss. But so reasons for that could be like he had mentioned that his father had hearing loss, but he also said that they think that it was due to him working in like machinery for all of his life and never wearing hearing protection. So I said that there could be a genetic factor, but again, we don't really know the full scope of that. So then another reason could be his years in the service where he himself did not use hearing protection all the time. As we know, exposure to loud noise can really affect our hearing as we age. And then he's also 90 years old, so the aging factor, presbycusis, that could be at play as well. Recommendations. We recommended that this patient have his current devices updated to fit the results of today's hearing evaluation. Also, audiologic reevaluation in 1 year sooner should changes be noted. So with patients at this clinic in particular, we give them the freedom to say, like, you can come in if you're noticing any changes, of course, but also like we have that 1 year scheduled for you for a new hearing test to be updated. But if you're feeling like there has been no changes or anything, we'd still like to see you. But of course, it's not life or death if you don't come in a year. So they have that option as well. Management plan. Patient will be returning in 1 week for a hearing aid check appointment in which we will update his current devices to his new hearing aids. He was not able to complete this update today. I think he was either going to get lunch with his wife or something. It was really sweet. I think they had a whole day planned. So that was really nice. They were a fun couple to work with. But so this is his management plan. Okay, so these are my questions for you guys, for y'all. So one, how would you describe this patient's tympanograms? Just go back and look, just are y'all paying attention kind of thing. What are some aspects of this patient's case history that are helpful? And then how many years were between his first hearing test and his last hearing test? So little thinkers for you. Alrighty. Hope everyone's doing well. All right. Bye-bye.